So what are the problems in our healthcare system and how do we fix it? My guest today has promised me that she has all of the answers. Susan Martinuk is a senior fellow with the Frontier Center for Public Policy. Susan, thanks for taking a few minutes to chat with us today about your new book and give us some of your thoughts on the healthcare system here in Canada.
Well, it's a pleasure to join you. Thank you for having me.
And I should note, I said that tongue in cheek. I know it's a very complex system. I don't expect to have all the answers today, but I know that you've put a lot of thought into the healthcare system over the years. You've written a lot about it. You've talked to a lot of patient stories, and you've certainly gathered some ideas on things you think could improve. Why don't we start first with patient stories? I mean, you've written the book, and I should note it. It's called Patients at Risk: Exposing Canada's Healthcare Crisis. What were some of the key stories that you've heard of over the years that kind of really drew you to this conclusion that we have a crisis in the healthcare system?
Well, there were a host of stories, so it's very difficult to choose just a few. In some cases, people died because they were denied access in time. You know, there was one fellow who, due to his doctor retiring, did not find out that he had cancer for a year. And then it was months after that before he could see an oncologist to even start the process of getting treatment. In Ontario, neurologists are so short of neurologists that one family doctor referred a patient to a neurologist and got a letter back stating that there was a 4.5-year wait to see that particular neurologist. So obviously that referral is moot. Another case in Ontario is where a former CEO, her husband was diagnosed with Parkinson's. They go to the neurologist, and of course they've got a zillion questions and things to try and understand about this new disease that's overtaking their lives, and yet they're allowed just 2 10-minute visits per year with the neurologist. Hardly time to address questions, medical questions, and lifestyle questions.
Mm-hmm.
And then just finally, there was one woman in BC who needed a hip transplant, and she had waited for so long and was in so much pain that she wrote that she was considering taking a fall because then she could get into the hospital and at least get some kind of treatment on her hip. And she said, "Don't think I'm joking about this, because I know several people who have actually done this." So when you're looking at people who are, deliberately falling to get into a hospital and get a hip transplant, you're looking at a very dysfunctional system in Canada.
Yeah, I mean, the stories that you've shared are appalling. We've certainly come across many as well. The Vancouver Sun had a story just recently talking about some of the horrific cases that have come forward. Doctors saying that, some patients that are, considering ending their life because fighting cancer is just going to be too long a battle with the system, having to wait and jump through all the hoops and that. I mean, it's appalling. We talked to a retired nurse in Ontario, just east of Toronto, who's actually lost 2 daughters now due to long waiting lists, and they had preventable heart problems that could have been fixed, but they're just put on waiting lists. The system didn't ration enough resources in their direction to provide the services that they needed. I mean, it's just appalling what is going on in some parts of the country. When you think about sort of we talked about it, there's lots of problems in the system, and there's things that go right too. But when you think about the biggest pressing problems, are there maybe 3 that stand out to you?
Well, I think obviously the first one is one we've talked about just briefly. As you said, waiting lists. Our whole system now there's no guarantee to access healthcare. There's just a guarantee that you'll get on a wait list. And that covers everything from specialist care to diagnostic procedures to surgeries, and now even to family doctors. Many people are having to put their name down on a wait list to try and get just a visit with a general practitioner. So that's a huge issue that needs to be addressed. The government periodically puts money towards trying to, get a number of surgeries done, and that barely even makes a dent. in the wait list at this point. A second thing that's, I think, become very public over the past few months, and particularly since the pandemic, is the issue of staff shortages. Doctors are desperately in short supply. Here in BC, more than 1 million people are looking for a family doctor, and across Canada, it's more than 15% of Canadians do not have access to a family doctor. So if something happens to them that requires some sort of, where you have to get into the system, where you have to get tests, or you have to go see a specialist, they've got no one to guide their care. And that's a rather frightening prospect right at this point. And then finally, I think the last thing, the big problem that we have is an inequality of access. And this is going to surprise many Canadians, I think, because we all live sort of under the belief that we all have equal access to healthcare, and that's why Canada healthcare is so grand. But in fact, people who have federal health insurance, and that includes our members of parliament, judges, members of the civil service, the RCMP, military, and even federal prisoners all have access to private healthcare facilities that will take them around the waiting list. So they don't have to wait for the waiting list. They don't have to wait 6 or 8 months to see a specialist. And that also holds true for members of unions and WCB claims. Because obviously for WCB or unions to pay somebody to sit off and wait 6 months for a specialist appointment, it's far cheaper for them to pay for private services than to have to pay them for 6 months to do nothing. So that's something that people need to understand when they consider changes that are required to our healthcare system.
So if you're a member of CUPE or any union rather, and you have, let's say, a hip problem that developed that wasn't a work-related incident, you're saying that member of the union could go to a private clinic and the union would pay for it, or is it they pay for insurance?
They pay for, the union has the patient has insurance with the union, and the union will cover a treatment or a trip to a private facility to have that problem taken care of. Dr. Brian Day in Vancouver, who has made headlines across the country for his case in trying to change the law so that everybody can have access to private insurance. Yeah. The bulk of his patients that he treats at his private surgical center, the bulk of them are union members.
Wow. That's wild. And so I guess it depend. It must depend on the union then, in terms of whether or not they have that.
Most likely the union, the type of job.
Yeah. Okay. Oh, that's interesting. I wasn't aware of that. So those are some of the problems. What about on the solution sides? Do you have any thoughts around maybe like big picture things that we need to think about as a country that could really move the system forward to improve the outcomes for patients?
Right. Well, I think the first thing that Canadians have to understand is that it's not an either-or situation. It's not either we have Canadian healthcare or we have American healthcare. There are a whole host of solutions that actually work, because when you look at the international comparisons with different metrics of healthcare, we find that the US and Canada are both at the very bottom of the pile. We're both ranked with very poor healthcare. So we don't want to look to the United States, even though many politicians, et cetera, will just try and use rhetoric to discourage any kind of change by saying that, if we don't have Canadian healthcare, we'll have American. And that's not true. So that's one of the first things we have to understand. Secondly, I think we need to make a long-term investment in education. And that's for doctors, for residents, and for nurses. In 1992, the government felt that it was paying way too much money out to doctors in healthcare. So they commissioned 2 economists to study the situation. And what they found was, or what they felt they found, was that the doctors were charging too much and there was too many doctors. So as a result of that report, then the number of seats in medical colleges were reduced. And since then, we have seen a diminishing number of medical school graduate in Canada. So it's time to open up the seats, get lots of have lots of opportunities for people who want to study to be doctors and nurses, and then provide the employment opportunities for them as well. Residents are another issue, because people who Canadians have subsidized their medical training for 12, 13 years, and then maybe only 40 to 50% of them might be able to find a job in Canada, and that would be on the high side of it. So we have to have positions to retain doctors once they have been educated. Another thing that I think would be very easy to do and would not cost a lot of money is to provide a lot of patient education and patient advocates. I think hospitals, it should be incumbent upon them to provide patient advocates that will help particularly older people as they're beginning a journey that's going to involve multiple visits and multiple testing and something like cancer visits to specialists. They don't understand that the system is so bad that they have to keep calling and checking to see if they can get in that day or if they can get in that week. To them, they just sit back and relapse. And that's not what you just can't do that anymore. If you want to get care and get care quickly, you have to press the system. And I think that's what people need to know.
Yeah, I think that's a very good point. And we've actually interviewed a lot of patients over the past few years, hearing their stories from across the country. And that's one of the key takeaways that I've picked up. And I tell this to my own relatives, that if you have a healthcare problem, you need to get your hip done or your knee, your cancer, whatever, you really do have to be your own advocate, because like you say, the system often forgets you. You're just a number.
Right.
I heard from someone the other day where this gentleman was on a waiting list for a couple of years for a hip operation. I don't think it was too severe. It was starting to become severe, but he was a bit younger and he's in somewhat good health. But at one point they phoned him and they said, "Oh, are you still waiting for surgery?" And he was kind of surprised by this, noting, "Yeah, or don't you keep a list?" And they had some problem with their computer and they were trying to fix everything and organize and figure out where they were. But so often parts of the system, they don't talk to each other. It's not a smooth system behind the glass, so to speak, when you're dealing with the healthcare system in this country. So you really do need to advocate for yourself. And I often think about how patients would be wise to think about their own public relations teams, because so often we see these stories, they pop up in the news, absurd story about a patient having to wait 2, 3, 4 years, whatever it is, or maybe they're worried about dying, whatever. It's a lot of media attention, and then magically a few days later it's solved. Suddenly this patient's surgery has been scheduled or whatever. So without that middle part where the patient goes to the media, where their story attracts attention, they're just going to continue to sit on a waiting list.
One interesting statistic that sort of follows up with what you've said and what we've discussed about even something as simple as referrals. McMaster University did a study, and they found that 1/3 of all referrals didn't even get seen by the person who they were supposed to be referred to. They either got lost or put in a pile somewhere and never responded to. So 1/3 of referrals are moot, which is alarmingly high when you're talking about a referral to a specialist. So that just shows how fragmented the system is.
Yeah, that's a shockingly high number. I wonder if that's related to one particular hospital, or is that nationwide?
No, that was Canadian.
Wow.
Pan-Canadian.
That's very surprising. I liked your point too about the HR side of this, right? That we do have a low number of doctors and nurses per capita compared with other developed nations. And it seems like so often when we do graduate staff in the medical profession, quite often they leave because, like you said, sometimes they can't get the hours that they need. Surgeons in particular, the government rations how many hours of surgery a surgeon can do. So they can't maximize their earnings, so they go off to somewhere else where they can maximize their earnings in it.
Well, in some cases, it's not even maximizing their earnings. It's having enough hours of surgery so that they can maintain their credentials.
Right,
That's an issue as well.
right. Wow. Well, you've certainly provided some good ideas there that I think we need to be looking at. I want to ask you, when you were working on this, on your book, were there any myths in particular that you had kind of picked up over the years where you thought, you know what, I really need to address that in the book because it's not true, and yet a lot of people believe that?
I think one of the great myths, as we've just discussed, is access. Canadians, and particularly older Canadians, just make the assumption that when they're sick, that they can go to a doctor, or when they need a hospital, they can get a hospital bed. And so it's such a shock to them, I think, to realize that none of these things happen quickly anymore.
Mhm.
I think perhaps of my parents who had never used the healthcare system before, they were 75 years old and suddenly they were diagnosed with cancer. And they were just absolutely shocked by the fact that, you have to keep calling the specialist to try and get in. You have to keep calling for your test results and to get in for testing. It
Mhm.
just, nothing happens quickly or easily, which is very different than what Canadian healthcare is portrayed to be.
Yeah, I think that's a good point. And people do think of this as a universal system,
Right.
but it's universal access to a waiting list in many respects because that actual service, quite often it takes so long to get that it can really affect a patient's life, couldn't it? When you've got people dealing with chronic pain, maybe they end up with additional health problems because they had to wait so long. They were taking painkillers. I've heard of cases where patients have had to take painkillers for a year, and then by the time that year is up, now they've got liver damage because their body's not meant to be taking painkillers for so long.
Right.
Um,
That's one thing that's important to note as well, is that there is sort of a ripple effect of healthcare, or of our broken healthcare system, I guess. And that is, it impacts the patient, and then beyond that, it impacts their family, then it impacts their job, perhaps, and ultimately the economy, which concerns some people. But it's not just the patient. And I tell a story in the book about a patient who is a young fellow who had a job and that he loved, and he hurt his spine and he required spinal surgery. Before he could even get an appointment to see the spinal specialist, he had lost his job. He lost custody to his son because he did not have his job. And he was basically confined to his living room because he couldn't move. And yet he was waiting 6 months before he even got a call back from the specialist. So that
wow.
shows you the impact. It really is a ripple effect.
Yeah. And I don't think governments really pay attention to that. We do these reports each year, Diet on a Waiting List, where we gather government data on patients having their surgeries, their appointments with specialists, their diagnostic scans canceled because they've passed away. And
Right.
governments don't seem, from what we can tell, it doesn't seem like governments really pay attention to this. They're not looking into it. They don't seem to really assess and analyze. As we've just talked about, the consequences to people's lives by simply making them wait for long periods to see a specialist, get a diagnostic scan, receive surgery, whatever. I think that's a shortcoming in the system. Were there any sort of key points from your book that we haven't talked about that maybe you think viewers might be interested in hearing?
Well, one thing that I think just sort of follows along with our conversation here is that I was told by multiple people who were involved in the system that they really believe that politicians are just letting the system crumble. Nobody seems to want to stick their neck out and call for real healthcare change, or even, nor does the federal government want to provide a lot of money to the healthcare system. And that's not what it needs. It needs systematic change. And a
Mhm.
lot of people just don't understand that politics should be separated from healthcare.
Mhm.
Otherwise, it's at the mercy of an election every 4 years, and then different parties have different ideologies and thinking about how healthcare should be run. So it's very difficult to have a long-term plan for healthcare and to really keep the system moving at a consistent in a consistent way and keep it developing and modernizing.
Mhm. I think that's a very good point. I know spending, when you look at the figures, government spending on healthcare has exploded over the past 30 years, increased well
Right,
above inflation, and yet that's the government's go-to answer when they run into problems.
right,
So often it's okay, well, we'll just announce a new program, we'll spend a bit more, whatever, without really understanding that we need reform. And as you said, we should be looking at countries, not so much within, not at the United States, but looking at other nations because they're doing a better job than us. Countries over in Europe, Australia, New Zealand, and so forth. I think we'd be wise to learn from them. Um, is there any big points that you'd like to make? Something that you'd like to add before we wrap up?
I think I'd just like to reiterate the fact that this book was written for Canadians, for the average Canadian. It's not a difficult read. There are a couple chapters that have the statistics, and you just sort of have to stay awake through those. But they are basically used in such a way as to underlie the points that I'm trying to make. So I think it's important. I think it's a book that all Canadians need to read. And I think it's a book, from what I've heard, it's a book that makes people angry when they read it. And it's sort of that I'm mad as hell and not going to take it anymore mentality that Canadians need to have in order to get some sort of change to our healthcare system. So it's written for Canadians, it's about Canadians, and I really encourage everybody to read it.
Oh, that's great. And I agree. I think people should be more upset because we're not getting a good deal. And it's not
Right.
necessarily that, I think we've got a lot of good people that work in the system. The problem is the system. It needs change to agree with your assertion that we need reform. Again, your book is called Patients at Risk, Exposing Canada's Healthcare Crisis. Where can people get a copy if they're interested in reading that?
Okay, that it is available on my website, susanmartinuk.com. And secondly, it is available through Amazon.
Great. And then if people want to learn more about the Frontier Center, where can they go to
They
find
can
you?
go to fcpp.org, Frontier Center for Public Policy.org. And I believe the book is also available through there.
Good stuff. Well, again, thank you, Susan, for taking a few minutes to chat about your book and sort of what you've seen over the years with healthcare. And hopefully we'll be able to chat again soon.
Great. Thank you so much. Take care.